Hello guys, yeah, this is Lawrence from Triumphant Lectures. So today we are going to revisit the bones, two of the bones of the leg. Yes, you know the lower limb is divided into parts, right? We have the thigh, the leg, the foot. So we are going to revisit two of the bones of the leg today, and which are tibia and the fibula. So the leg is distal to the thigh, as you guys already know, and there are two bones there. We have one which is medially placed, known as the tibia, and the other which is laterally placed, known as the fibula. So I'm going to like show you guys the important landmarks that are found in these bones and what are the usefulness of those landmarks. That's what we're going to do. We're going to do an overview. Yeah, why in our notes which we'll be giving out, we're going to like give out the details in those notes. So now let's dive into our business for today. So as you can see now, this is a part of, look at now, these are the two bones of the leg. These are the bones of the foot. Then the bone of the thigh, which is the femur, is not here, right? So I'm going to use this as an overview. Now look at this now. You can see that there are two bones here. Like now, let's now do side determination of this bone to know if this is the right or the left. So now the question now is this the right or the left lower limb? So now if you are to determine if this is the right or the left lower limb in this model, you have to check for two things. Check for the position of the lateral mellisus and the medial mellisus. Usually the tibial bone has medial mellisus while the lateral bone has the lateral mellisus. So that's the first thing you check out for. So look now, you can see here now you have this of the what of the tibial bone. So this is the medial mellisus. Why this now? You have this projection, enlarged distal end of the fibular bone, known as the lateral mellisus. So from this now, this is medially placed because you can see that the tibia is always medially placed while fibula is always laterally placed. So from this now, you say that since the tibia is medially placed, fibula is laterally placed, this is the left lower limb. So what I'm holding right now is the left lower limb. You get it? So now we're going to discuss everything in detail. So we're going to start first with the first bone, which is the tibia, the one which is medially placed. So now the question now is, what is the tibia? The tibia is one of the bones of the leg. Is the second longest bone in the body. You know, the longest bone in the body is the femur, but this tibia is the second longest bone in the body, and the location is in the leg, usually in the medial aspect of the leg. It's medially placed as usual, and it has two articulation. It has an articulation here. You can see from here, you can see there's an articulation here. The tibia is articulating with the fibular bone. So this joint which is formed is known as the proximal tibiofibular joint. That's one of the articulation of this tibia bone. Then we have another here in the distal aspect of it, which you can see here. You can see it, articulation with this tibia bone and this fibular bone, known as the distal tibiofibular joint. That you can see here, right? So that's the two articulation of this tibia. So the function of the tibia bone, the major function is it's usually for weight bearing. How? You know, normally probably your weight, abdominal organs, those your organs like that are superior to this structure now, they tend to like apply pressure on the bones. So the tibia tends to like bear that weight. Also inferiorly too, it tends to bear the weight. That's why you see that the tibia has an enlarged proximal end for bearing the weight, and also has an enlarged distal end for also bearing the weight, that you can see here, right? So now the question now is, what are the parts of the tibia? What are the important landmarks of the tibia? So now I'm going to first look at this one now. So this is a typical tibia bone, separated, is not joined with the fibular bone. So now the question now is, I'm holding two of them, which is the right and which is the left? So the first question you ask yourself here is, you know, tibia bone always have medial meniscus. So you have to ask yourself, where is the medial meniscus? That's the first thing you have to ask yourself. So now looking at it now, you see that this is the medial meniscus, and then after locating the position of the medial meniscus, that is the proximal part, you have located the proximal part, you have located the distal part, and you have already identified the medial meniscus. This is the medial meniscus here, and this is the medial meniscus. So now that's the first thing you identify. Then now check out for the anterior aspect of this bone. So from here now, this is the anterior aspect of the bone, this will facing you, and this is the anterior aspect of the bone. So that's the second part thing you need to check out for. Then the next thing you need to check out for is, you should know that always the medial meniscus is always, as the name implies, medially placed. So now you're going to check which of them is medially placed. From here now you can see this is the anterior aspect, and this medial meniscus is what? Is medially placed. This is the anterior aspect facing you, and this medial meniscus is what? Medially placed. So you can see now, this, as you can see, is the left tibia bone, and this, as you can see, is the right tibia bone. So I'm holding the left tibia bone and the right tibia bone. So now we're going to just discuss the parts using this left one. Okay, let's try with the right one. So now this tibia bone, it has three parts. It has a proximal part, it has a shaft, and has a distal part. Those are the three parts: proximal part, shaft, and the distal part, that you can see. So let's talk about the proximal part. The proximal part, as you can see, if you look at it very closely, it has, now you're looking at the anterior aspect, right? Look at anterior, you're looking this way. So what you're looking at now is, this is the medial aspect, right? This is the lateral aspect, right? So what you're looking at is, this is the medial aspect and this is the lateral aspect, right? So now you can see within this region now, then you can see that the proximal aspect is enlarged here, and you can see that the lateral aspect is also enlarged. So this enlarged proximal part of the tibia bone is known as the medial condyle, while this enlarged lateral part is known as the lateral condyle. So we have the medial condyle and the lateral condyle. Then now look very closely. You can see that between this medial condyle and the lateral condyle, you have a superior articular surface. This surface now is what is going to articulate with the condyle of the femur. Okay, so let me show you that. Look at now. This now is, okay, this is the right femur, which you can see here. Look at now. This bone is going to form articulation with this, which you can see. Are you seeing it? So it's going to form articulation with the condyle of the what? Of the femur. So now we've talked about the medial condyle and lateral condyle, right? So now we said this is the what? Superior articular surface of the proximal part of the tibia bone. So if you look very closely, you're going to find here a medial surface that is more concave than the lateral surface. This medial surface is known as the medial surface, as the name implies, and you have the lateral surface. So now look also. You can see tubercle, you can see an upward projection between the medial condyle and the lateral condyle. This upward projection is known as the intercondylar tubercle, because they are between the condyles. They are called the intercondylar what? Tubercle. So we have the one medially placed, known as the what? Medial intercondylar tubercle, and the lateral intercondylar tubercle. In between them, you're going to find is a smooth area known as the what? Intercondylar eminence. So this is important landmark for this proximal part. Now look very closely. You know that the fibular bone is usually attached laterally to the what? To the tibial bone. So within this region, just inferior to the lateral condyle, you're going to find a facet here. Look at the facet. This facet is for articulation of the head of the fibular bone. That's the importance of this facet in just inferior to the what? Lateral condyle. So this is the most important landmarks for the proximal part. So having talked about the proximal part, let's move on to the shaft. The shaft, as you can see, has surfaces and has borders. The shaft has an anterior surface, which you can see here. This is the anterior surface. It also has a, look now, see, this also has a medial surface. We are looking at the right. So this also has the medial surface. It has anterior surface, medial surface. It does not have lateral surface, just anterior surface, medial surface, and the posterior surface. That's the one facing me now. Anterior surface, medial surface, and the posterior surface. On the anterior surface, you have a border. You can see this prominent ridge along the anterior surface. This prominent ridge is known as the anterior border of the tibial bone. This is the anterior border. Are you getting it? So now, laterally placed, you're going to also find a border. This border you can find here, that is laterally placed. This border is, as the name implies, is known as the lateral border, also called the interosseous border. You know why it's called interosseous border? The reason why it's called interosseous border is because we have what we call the interosseous membrane. It's going to connect this tibial bone to the fibular bone. So look now, from this model now, you're going to see that there's a space in between, right? Look at the lateral border now. You can see the lateral border. So there's a border there. Look at the lateral border, and there's interosseous membrane that's going to connect this tibial bone here from the lateral border to this fibular bone. I get it. So that's the importance of that lateral border. That's why it's also called the interosseous border. So having said that, we said we have anterior surface, posterior surface, and the medial surface. We have borders, anterior border, we have the lateral border, right? We have posterior border also. So now another important thing you need to look at is, look now, this is the anterior border, right? If you move superiorly, you're going to see that the anterior border forms a projection, anterior projection. You can see this roughening here. This is known as the tibial tuberosity. Tibial tuberosity, and the reason for this is for the attachment of the patellar ligament. That's the purpose of this. Why, if you look at the lateral border, you see that the lateral border continues inferiorly, and then in the distal part of the tibia now, it's going to form a depression. It's going to form a notch known as the fibular notch. This fibular notch is usually for attachment of the distal part of the fibula. Are you getting it? So that's the importance of this one. So lateral border is going to continue inferiorly to form a notch known as the fibular notch. So these are the important landmarks for the shaft. Now we go into the distal part of this tibial bone. The distal part of the tibial bone, the two important landmarks, important features you need to take note of, is one laterally placed and one medially placed. The one which is, now we're looking at the right? So we have the one which is what? Medially placed. This distal part of the tibia forms a projection, downward projection, known as the medial meniscus. That's this, the medial what? Meniscus. And the purpose of this medial meniscus is to form a joint, with one of the tarsal bones. Are you getting it? Because it's going to form a joint with the tarsal bone. That's the importance of this what? Medial meniscus. That you can see here. You can see here now. Look, we said this is the left, right? Look at the what? Look at the medial meniscus, and it's going to form a joint with this bone. Look at the tarsal bone. So you see, it's forming a joint. The medial meniscus is forming a joint with the what? With the tarsal bone. That you can see here. That's the importance. So this joint is known as the what? It's a part of the what? Ankle joint. Are you getting it? So that's the importance of this medial what? Meniscus. So having talked about that, we go laterally now. Laterally, you're going to find a depression. As we said, that the lateral border is going to continue inferiorly and form a notch, and this notch is known as the fibular what notch, that you can see here. So medially, you're going to find what, a downward projection known as what, the medial what, meniscus, and laterally you're going to find a notch formed by the lateral border of the tibia, known as the what, fibular what notch. What's the purpose of this fibular notch? The purpose of the fibular notch is for articulation of the distal part of the fibula, that you can find here. You can see that from here now. This is the left, right? Look now, in this lateral aspect, you're going to, there's the notch here, the notch is here, and you can see that this distal part of the fibular bone is connecting, is forming articulation with this fibular notch. So that's it for the tibia bone. We're going to talk about the proximal part, the distal part, and the shaft. Proximal shaft and distal part. I've talked about the important landmarks, the condyle, medial and lateral condyle. They talked about structures here in the tibia platus. We have talked about the intercondylar tubercle, intercondylar eminence. They will talk about the shaft, which has surfaces and borders. They will talk about the distal part, which has only two important landmarks, one medially placed, one laterally placed. The one which is medially placed, we said, is called the what, medial meniscus. The laterally placed important landmark, which is formed by the lateral border of the tibia, is a notch known as the what, fibular what, notch. So now we are done with this what, with this bone, the tibia bone. So now we are going into the next one. I've showed you guys how to identify it, right? The right and the left. First thing you check for the medial meniscus. Once you check for the medial meniscus, then check for the anterior surface. If you check for the anterior surface, you must surely see a prominent roughening or projection called the what, anterior border. Once you are able to get that, you're able to differentiate which is the right and the left. If you want to also differentiate more further, just check out for that notch formed just inferior to the lateral condyle. Once you check out for that, these features, you surely know that is the right or the left. So now, after having said that, we're going to move into the next one, the second, which is the what, fibular bone. Fibular bone. This fibular bone is also a long bone, right? It's a long bone, and the location is in the leg, but it's what, laterally placed. This is the left leg, right? So it is what, laterally placed. Laterally placed. So now we're going to discuss it in details. So I'm going to bring out it here. So how do we identify if this is the right or the left? First thing you need to check out for the lateral meniscus. Tibia bone has medial meniscus, but this one has lateral meniscus. Are you getting it? And this one is very prominent. If you check your ankle now, you're going to observe it's very palpable. It's palpable in the lateral aspect of the ankle. So now look, you can see here, this is what, lateral meniscus of this bone. You can see it here. This is another what, okay? Yes, this is the what? This is another what, lateral meniscus. See, there's a difference. You can see the head now. The head is different from this distal part. Proximal part is different from what? The distal part. So once you have identified this lateral meniscus, the next question is check out for the anterior surface. Check the anterior surface. Which is the anterior surface? That's what you need to check out for next. Then another important thing you need to check out for is the notch. There's a notch that is formed. Now look now. There's a notch that will be formed. There's a notch that will be formed here in the distal part of this fibular bone that is forming a joint to the tarsal bone. Once you're able to identify that one, let's check it out now. Look at the notch here. Are you seeing it? So look now. If this is a notch, meaning that you must have a medial what? If this is a notch now, it means that there's what, a medially placed bone here. This is the tibia, right? If you are attached here. So we are trying to get to conclusion soon. Then let's check this one now. You can see there's a notch here. There's a notch here, right? So this now, you can conclude that this is the what, right fibular bone, and this is the what, left fibular bone. If you want to go into more details, you can also check for the notch formed the um, by the tibial bone. You know, we talked about that fibular notch that is just inferior to the lateral condyle of the tibia. So if you want to be more specific, you check for it also. So now we're going to discuss with this right fibular bone. The most important thing you need to know is what's the location is laterally placed, and what is the purpose of this bone. The purpose of this bone, it does not carry any weight. It's not for weight bearing. The purpose of it is just for what? For articulation of what? Muscles. That's the purpose of this fibular bone you're seeing here. It does not carry any weight. It cannot carry weight. Now look at now, this bone cannot carry weight. Are you getting it? So it's mainly for what? Articulation of what? Of muscles. So it has what? 3 parts: proximal part, shaft, and the distal part. So now let's look at the proximal part. The proximal part has 2 parts. It has a head and has a neck. The head now, since this is the right now, you can see the head now is going to form a notch here. It's going to form a notch here. I hope you guys are seeing. It's going to form a notch here. This notch is for articulation with that fibular notch I told you guys of. The fibular notch which is found inferior to the lateral condyle. I told you guys now. Look at what I mean. Look at the this is the lateral condyle, right? This is lateral condyle. Look at, there's a notch here. So this head now is going to form a notch there, a tibial notch there. It's going to form a notch that will articulate with this what? With this fibular notch of the what? Of the tibia. So that's very important landmarks there. That's a very important landmark there for the head. So now for the neck, the important thing you need to know about the neck is when we start talking about the nerves, or when you study the nerves, you observe that there's a nerve known as the common fibular nerve. It's going to pass posteriorly, and first of all it will pass laterally, posteriorly first, and then pass laterally along the neck of this proximal part of the fibular bone. So that's the important feature you need to know about this neck. So it has a head and a neck. So now we're going to the shaft. The shaft, you can see, is very long and very thin. The shaft, as you can see, has anterior surface. It has an anterior surface. Okay, it has an anterior surface. It also has a lateral surface. It has anterior surface, it has a lateral surface, and it also have a posterior surface. Anterior surface, which you can see here, lateral surface, and what? And the posterior what? Surface. You get it? It also has border, and the major border is the lateral what? The lateral border. The lateral border. That is the major thing, the lateral border, because lateral border is going to continue inferiorly. It continues inferiorly and form this projection known as the what? Lateral meniscus of the what? Of the fibular bone. So we talked about the shaft. Now let me recap. We said it had anterior surface, it has what? A lateral surface and a posterior surface, which is behind it. Look, it's facing me. The one you're seeing is the anterior surface. The lateral surface is by the lateral aspect, and the posterior surface is facing me. Then you have this lateral surface is going to continue inferiorly and form this lateral border surface, is going to continue inferiorly and form what? The lateral meniscus. So that's it. That's it. So now for the distal part now, the major thing you need to know about it is this lateral meniscus formed by the what? Lateral surface of the fibular bone. And you can see here, you have this notch here. This notch is also for articulation. Look now, this is what I'm trying to say. There's a notch. You can see that this is the what? Fibular bone. And this fibular bone, you can see, is forming articulation with this tarsal bone. So that notch there is known as the what? Fibular notch. It's usually for articulation with the what? With the tarsal bone. So these are the bones. These are the important landmarks you need to know about these bones. So guys, I just hope you guys followed up. We've talked about the 2 bones. We talked about tibia and we talked about the fibula, right? We said there are two long bones. The tibia is the second longest, which is medially placed, while fibula is laterally placed. We talked about the parts. Tibia has proximal, shaft, and distal. We talked about the important prominence and landmarks. Then we went further to talk about the fibula. We talked about the importance, the function, the location, and then we talked about the parts, right? We said we have the proximal part, shaft, and the distal part. We said the proximal part has a head and neck, the shaft has surfaces and borders, and distal part, important part, since you need to know about it, is that projection, downward projection formed by the lateral surface known as the lateral meniscus, and then a notch which forms articulation with the tarsal bone, which is a part of the ankle joint, right, known as the fibular notch. So guys, if you have any question, please do well to ask. I'm happy to have this section, this discussion with you guys. So I'm hoping to see you guys in the next one. Have a nice day.